Precious, what can you report? If there is any good news from your side, let's start with that.
Well, good news. The good news is that in the Bono region, on the 6th of May was when the region reported its first, case. Thereafter, the region has been spared of, issues or reports of confirmed, cases here in the region. Authorities continue, to try and then manage the situation by way of the safety protocols to ensure that we do not have other reported cases. What I can say by way of figures is that from the 6th of May, that we recorded our first case in Sampa, in the German north of the Bono region. The Ghana Health Services has gone through 966 samples, that is from the enhanced surveillance, and 136 from their routine, samples has also been taken. But relative to the Sampa case, 178, samples were taken as a result of contact tracing, out of which we had 161 from German North, that is Sampa itself, and then they brought it down to Brekum, where they had to interact with 17 other people. But the good news again is that all this contact tracing, the 178 samples taken, the results came out negative. These obviously are good news for us here in the region. But the Ghana Health Services in the region themselves, they have some few issues, some few challenges relative to social distancing and then obeying the safety protocols here in the region. They are saying that a majority of people are doing out of fear instead of out of necessity. That is according to the Ghana Health Services Director in the Bono East region, Dr. Kofi Issa. Now he is saying that social distancing, wearing of face masks and other things, hand washing under running water only happens when people feel that they are being watched. But the moment they are on their own, then they throw all that under the carpet, and that is an area that he believes that should be worked on again seriously. Now, he is also, saying that citizens in the region have been complaining bitterly about the way authorities, that is the security officials, treat them when they meet them outside without face mask or following the other safety protocols. They have been, beating them, and that is something that he believes can also work on. He believes that rather these officials can have enough face mask with them so that when they meet you, they will just give you one if they find out that you are without a safety, protection, that is face mask and other things. But his major concern, I must say, in the region has to do with testing, which he believes is a major issue, particularly for suspects, for patients and their relatives. He believes the region used to rely on KCR in Kumasi, but now Tamale has been added. And he is calling for an upgrade of the Ketampo Health Research Center to ensure that the region can cut down drastically the backlog of samples that needs to be tested in the region.
Let's listen to Dr. Kofi Issa, the Bono Regional Health Director. He's been speaking about the COVID-19 situation there.
We took samples from the contacts. All in all, we took samples from 178 contacts. 161 of them from the German North District and 17 from Brekum. So far, from the tests of the contacts we have received, the results all have come out negative. Most of the but let me give a summary of the findings. That we went into town and sampled areas, lorry parks, markets, to find out how they were sticking with the social distancing, hand washing, and what they call mask wearing protocols. In other areas, things were done very well. In other areas, there's still room for improvement. But the general situation is that as we move from morning, by evening, the masks are off. So that is something that we would have to work on as far as behavior is concerned. Also, you find people will social distance when they have somebody watching them, especially they know there's a checkpoint ahead. They will definitely social distance. Immediately they pass there, it becomes a situation where they tend to think that they are on their own, which we think that we should go beyond actually letting people social distance or wear masks or wash their hands out of fear, but it should be out of necessity. So the basic question we would want everybody to be asking is not why did you not wear your mask, or where is your mask, but please wear your mask. He says, I don't have one. He says, please have one, because you are going into an area which is a public place as defined by the regulations which got sent to us. Logistics, we have been able to send quite a lot. There have been donations from various bodies. The citizens of these 3 regions abroad also made a donation. There have been philanthropists in town who have made donations, and we know politicians and other opinion leaders. The government has also sent quite a number of barges of logistics as and when is needed. And some of these have been targeted towards the 3 treatment centers which we have in Winchi, Brekum, and then the regional hospital. A bit of innovation has come in with, coming in when it comes to hand sanitizers and face masks and all that. So, right now nobody has any complaints about shortages of face masks or hand sanitizers. It might come in, we will start getting, especially other logistics when we start getting our first case.
And there, the first case has come. Dr. Kofi Issa is also expressing worry over the backlog of samples due to the limited testing capacity in the country. KCCR in Kumasi has been near testing center, and now Tamale has been added. But Dr. Issa says an upgrade of the Kintampo Health Research Center will or can ease the pressure and frustrations of patients, suspected cases and their relatives.
Our problem has been with laboratory testing. You know, government is making efforts to make sure that our Kintampo laboratory is also up and doing. In the meantime, we send our samples to KCCR in Kumasi and in Tamale. Sadly enough, we have a whole backlog of samples lying there. And it is a bit of heart-wrenching to simply put somebody, especially if somebody's sample got sample got taken actually around the time of the first case that we had, and then up to now we still have 10 samples, the results of 10 samples pending. And these are things in which you find families have to undergo some sort of anguish. But we're working around the clock to make sure that these 10 samples are sorted out, including all other samples that are delayed. We would say we understand what the backlog or the workload is on the laboratories. They are also doing their best. But you see, when we are dealing with the general public, it comes to a time that, if we don't manage the situation very well for people to understand the challenges, despite what all the best that we are doing, it can simply get completely out of hand. So surveillance, we continuously encourage our districts to do the enhanced contact, enhanced surveillance, looking at the vulnerable groups to make sure that they are able to take the samples, and then we would send for testing. For the enhanced surveillance, we've been able to do 966 samples so far. For the routine, we took 136 samples, and you remember when we had a positive case at Sampa, definitely he had contacts, and we have taken the 178 samples. That was the first one, and then we have some are retesting, and hopefully today or tomorrow we should be able to get the results of those retesting from Tamale, because this time we have sent the samples to Tamale. All in all, it has been a very new experience for us in the health sector, because this is something we are used to, outbreaks of diseases, but this is something new to all of us. The challenges that we are having now, we would want to turn them around to opportunities to make sure that at least the gaps that we have identified, we would be able to make sure that we turn them to opportunities and strengthen our system. So as we're working here, we have our logistics that we received and we distributed. We normally update that one in here.
Let me get to Inatalia Kwanza, that place we're told, the Western region, Takoradi and Takwa, we were told, supposed to be the epicenter in the Western region. I've lost Ina, but I'll go back to Precious to wrap up with him. Precious, now that there has been a confirmed case in Bono, an area that didn't have any, health authorities there doing anything special, particularly special, to make sure that this doesn't spread further? We've seen regions where, you know, there was just one case and the next week they have spiraled to about 16, 20. Are there any lessons they are taking from what has happened in the past in other places?
Yeah, certainly some lessons have been taken. If you heard the health director, you know, he said that on the 10th of May was when the region recorded its first case in Sampa. And from then up to now, 28th of May, we are still with that single case. And as we know, that first Togolese national, you know, has been treated and then repatriated, you know, to his country. So the measures that has been taken to ensure that we don't have a community spread, which as at now we don't have, and they continue to tighten those measures to follow and then obey strictly all the safety protocols, the social distancing, wearing of face masks, particularly at areas where we normally gather, that is our market centers, and the assemblies have taken measures, you know, to spread the market centers to different locations so that people will not find themselves in a crowded area. And I think so far so good, but a lot needs to be done. It should not be seen or it should not be done in fear, but the residents themselves should see it as a necessity to obey all the safety protocols. And per the Ghana Health Services, if all these are done, then we will be able to maintain the single case that the Bono region, Amma North, recorded some 3 to 1 month ago.
Hopefully, this one person has not been in contact with so many people.